Hi, and very much welcome to this session, which I think will be lively and very interesting, and welcome to the panellists. Just some sort of, I don't know if it's housekeeping, but the sessions will be recorded, audio and video, so letting you know about that. And also to put your mobile phones on silent, but you are really encouraged to tweet in this session, and that's #Festival of Health. I've been working in this field for quite some time, and with this particular session, I am really interested in stimulating a conversation here and hearing from yourselves about what I think comes to the core of this issue. So what is a healthy city and what are healthy communities? And particularly, what role do these terms have in supporting health in neighbourhoods and across the population in terms of what we increasingly hear as the huge economic burden of the NHS, particularly in terms of non-communicable diseases. And by that, they're often termed lifestyle diseases, as if people would choose a certain lifestyle disease. But the diseases that often the environment of our cities and towns, whether it's the economic environment, the transport environment, the green environment, the housing, diseases where some of the these factors are implicated in the disease, in the non-communicable disease. So we've got three speakers who can talk to that and talk to also the health inequalities and that underlying nature way in which the physical environment, the urban environment of Bristol supports or detracts from health. So the speakers we have Sohail Bhatti, who's the Director of Public Health here in Bristol. He's been a Director of Public Health for 12 years, previously in Huddersfield and East Lancashire. He's worked with the Healthcare Commission in London, and as you'll hear from his talk, he has a passion around reducing the gap in health inequalities, looking at health inequalities. And he's going to look at what the challenges are here in Bristol, both in health and health inequalities, with, I think, an emphasis on non-communicable diseases and these diseases that might have their origin, or there's a lot of evidence that the origin is in the places we live and how we make those. After that, we'll hear from Liz Zeidler. And Liz is co-founder and director of Happy City and the chair of Bristol Green Capital Partnership. It's a Bristol-based, Happy City is a Bristol-based and globally leading project seeking to put health and happiness of people, place and planet at the heart of how cities work. And they're doing some great work here in Bristol. And if you look at their annual report, there's any number of different projects and objectives, some in partnership with the New Economics Foundation, Bristol City Council, Bristol Public Health, reaching into some of the neighbourhoods that we might be talking about as we go forward. And finally, George Ferguson, who, you know, it's one of those trite things, isn't it? Needs no introduction. But George is Mayor of Bristol. But importantly, he's a mayor that comes from a background of urbanism, of seeing the importance of making of place and how place influences communities and the way that communities can support each other. He co-led the formation of the Academy of Urbanism, who are also increasingly seeing that population health is a really important part of the mix of quality of place. I think that, and he was appointed CBE in the 2010 New Year's Honours List. So the session format will be Sohail, Liz and George making 15-minute presentations or talks, and then I might draw out some themes across that, and then very much hearing from you and generating some discussion, closing at 11:30. So without any further sort of from me, Sohail, take the floor.